Hello everyone, welcome back to the channel. This is Dr. J. I've got two patients for you today. The first one we're calling Nugget. The patient doesn't have massive wax accumulation and impaction. This right ear we're going to treat first, but the other ear, the left side, is kind of the big nugget on this particular patient. We're just starting. We have the speculum in the canal. Again, this isn't totally obstructing the ear canal, but it looks like it's starting to. So it was a good process to go ahead and just get this cleaned up for them while they're with us in the office. It doesn't take but a few minutes to clear up a small amount of cerumen like this. This is just with the Fraser suction, I should say. It's this looks like a number 7 that I'm using here. And it's pretty universal in being able to just perform most of your average debridements. And a little bit of buildup and pile up here once it gets to the bottleneck portion of the ear canal. Usually the mid and inner portion of the ear canals are much wider and have a larger diameter than at the actual exit, where the skin hairs are located and where the actual cerumen is produced just in front of that. But that cleaned up just fine. Now on this side, there's a very obvious obstruction. I mean, we cannot see around it at all. The patient did have what we call a conductive hearing loss, and so they were probably missing 15 to 20 decibels out of this ear. And that's pretty significant. If you want to equate it to, if you want to try it at home right now, what you do is just put your hand up over one ear and just completely block that ear, and just go ahead and start talking or have someone talk to you, and that's about 15 to 20 decibels worth of hearing loss. And so that's what this wax plug will do. It'll block the sound waves and block off about that much of her hearing. So when I see the big plug like that, I played with it for a moment, and I was like, yeah, we're going to go ahead and start with some lubrication. So I added the Colace that you saw there, and give it a little jiggle and try and work that Colace in between the edges of the plug and the skin of the canal wall. And it starts to move fairly quickly here. This did not take a lot of time. You'll see when the plug comes out, it wasn't a really deep plug. Most of it was towards the outer portion of the ear canal. It wasn't a big, long plug. If it was this hard and that much deeper, then it would probably have been harder for us to get rid of it. So I try to, once I pull out with the speculum and reach back in with the Fraser suction, it's moving, but it's not moving very well. That bottleneck is kind of holding on to it a little bit. So right here I switched to my right angle and able to just hook into it and start to roll it out. Being very careful that I'm not digging into the skin. I'm always digging into the wax and trying not to use the skin as a fulcrum. And here it comes. Here's the nugget. So that front edge there, that's what we were looking at. And then deep in the canal, you can see it kind of widens top to bottom and side to side. Here's the ear canal afterwards. It looked good. The second patient here, we're going to call it hairy, and you'll see here in just a moment why we call it that. This patient had a very hairy outer ear. Now this is on the part of the ear that we call the tragus, and a little bit on the lower part is called the antitragus. You got the bump up front and then a little bump in the back or down at the bottom of the screen. And it almost looks like, when I first was editing this video, I was like, that kind of looks like baleen. If you don't know what baleen is, it's the type of whale filtering system. For certain whales, they don't have teeth. They have baleen, which are kind of filtering teeth. And a fact I just learned today when I was trying to remember what the name of that is actually it's keratin. The whale's teeth are that have the straining style of teeth, almost look like a big brush broom. They're actually made out of keratin, and I know that a lot of these earwax cleaning channels love to refer to some skin in the ear canal as keratin. Keratin is yeah, it's a protein, and a lot of the superficial dermis, or what we call the epidermis, is comprised of that. It's probably I think it's the major structural protein in skin. And it also turns out to be the major structural protein in whale teeth that we call baleen, B-A-L-E-E-N. So this gentleman's, once we got past the hair, he had a very large plug. And so I'm going to apply the Colace multiple times here and do my best to try and loosen it up. But it was stuck pretty tight. Despite having some good lubrication around it, we're trying to work it through a much smaller and much narrower bottleneck. It's getting some good movement, but it's still being very stubborn. So I'm going to clean it up just a little bit more, elevate the edges to the point where I can try and get some more Colace down in and around it and behind it. Even with the right angle, it was too soft to be able to dig into it and pull it out. So this outer part was just starting to break away. And it's a little aggravating. You get a good purchase with the right angle, or with the suction, or even with a loop curette, and it just breaks away, and it's kind of frustrating when that happens. But so I get back on the suction. It's the only thing that seems to be only thing that I'm able to get a good grip with it with. So we're lifting up that bottom edge again. We're going to apply some more Colace, really trying to get it worked in and around there. There we go. So we're starting to see some better movement now. You can tell that it's starting to move to the outer portion of the ear, because we're starting to see the hair-bearing portion of the ear canal. There we go. So we should be able to get this out here in just a moment. So big plugs like this, again, like the other patient, these are the ones that cause the hearing loss. They can get large enough to start to cause discomfort, and if left alone, could potentially develop into a keratosis obturans. Here we are with the alligator forceps, and able to get enough of a purchase on it that we were able to slip past, at least the initial part of it, past the bottleneck of the ear canal. And here it comes. See how that looks like baleen? I think it looks like baleen. Anyway, so here's the big plug. It was almost the entire length of his ear canal, and always satisfying when the big plug comes out and you've been working on it for a while. Patients always so appreciate it as well. So once that's out, we take a look back in. You always take a look back in to make sure the rest of the canal is clear. Just get this guy out of the way. And coming back inside, there was just a small bit of cerumen. So utilizing the 7th suction again, just get rid of that last little bit. And the rest of the canal is clear. Eardrum looks healthy, looks great. And thanks very much for watching. Appreciate you sticking it out to the end. We'll see you on the next video.